Hello and welcome to Cerhi from the stable of one of Africa's foremost universities, the University of Benin. Today's program features two very distinguished personalities who make Cerhi tick in Nigeria and beyond. Cerhi being the Center of Excellence in Reproductive Health Innovations. It is my pleasure to introduce Professor Emeritus of Physiotherapy at the Chicago State University, USA, who has worked previously as Professor and Vice Dean, Faculty of Health Sciences, Obafemi Awolowo University, Ile-Ife, Professor Joseph Balogun. Welcome, Prof.
Thank you very much. You're welcome.
Professor Balogun is an associate and partner of Cerhi. He is currently in Nigeria as a Carnegie Fellow to teach postgraduate students and to conduct research and publications with colleagues. Again, Prof, it's my pleasure to welcome you to the program.
Thank you.
And welcome to Nigeria.
Thank you again.
We are also privileged to have with us in the studios a distinguished professor of Obstetrics and Gynecology and Reproductive Health, editor of several international journals, director, Grants and Research Development Administration, the center leader of Cerhi, University of Benin, and coordinator, World Bank projects. In fact, he needs no introduction. I'm talking about Professor Friday Okonofua. Welcome, Prof.
Thank you very much for inviting me.
I'm sure I just scratched your credentials on the surface. Could you tell us more about yourself?
Thank you. I'm from Kogi State, from a very small village in Kogi State called Idofin in the east district of Kogi State. I was raised there, attended school, both my secondary school and high school in the state. Then it was called Kwara State. And I obtained my bachelor's degree in physiotherapy from University of Ibadan in 1977. Did my youth corps at Mubi General Hospital and relocated back to my state. It was Kwara State then, to work at the General Hospital in Ilorin. Worked there for 2 years before I went for my postgraduate education in the United States in 1980. Obtained my bachelor's, my master's, and my doctoral program from the University of Pittsburgh, where I got my doctorate degree. Worked in the United States for 2 years before relocating to Nigeria with the goal at that time to contribute to national development. It was at Obafemi Awolowo University in 1986 that I met my iconic, I call him my iconic friend, Professor Okonofua, in 86. And I was at Ife, rose through the academic rank, I became vice dean of my faculty, and in 1991 I relocated back to the United States, and I have been there since then. That's almost 30-something years.
Wonderful. Okay, Prof. Professor Okonofua speaks so very highly about you. What is your relationship with the Center of Excellence in Reproductive Health Innovations, Uniben?
Okay. I've always worked closely with Professor Okonofua, starting from when he was the Vice Chancellor at Uniben. And that association obviously metamorphosed and transferred to Cerhi when he returned from his Vice Chancellorship. In 2019, during my sabbatical, I was here to conduct or to facilitate a 5-day workshop on research method at that time. And also during that particular year, I encouraged Cerhi to enroll in, or to obtain an accreditation, international accreditation, which they did. The program at Cerhi became accredited by 2 international organizations, one in Belgium and the other one in France. Also, I've worked with Cerhi, with Dr. Okonofua, in a book that we co-edited.
Prof, what special qualities have endeared two of you to engender the kind of harmonious working relationship that you currently enjoy?
All over the campus, we are well known. And we had two young people at that time who were always doing things that other people were not doing. We were always working outside the bus, doing research, publishing. I think it was a very good, I can say without any fear of equivocation, that since I entered the university system, from 1986 to now, which I entered the university system, I think it's the only one I've met who has the same academic comportment and dedication, determination I have. So, and right now we are still doing things together. We just edited a book, and now I'm writing a book on my experiences at the University of Medical Sciences and Vice Chancellor, and I've completed it. He's the one editing it, going through page by page, making corrections and so on and so forth. So I can say it's not only my brother, it's my academic friend.
Okay, Professor Balogun, you're a physiotherapist.
Yes.
What is physiotherapy all about?
Okay, very good question, since majority of Nigerians are still in doubt about what physiotherapy is. Physiotherapy or physical therapy in the American system means the same thing. It's a healthcare profession in which the practitioner evaluates their patient. And following the evaluation, they arrive at what we call a physical diagnosis, which means they will be able to pinpoint the causation of that disease and select from a wide variety of modalities that they can use to therefore treat the patient. And the modalities ranges from mechanical modalities to physical agents. And when we talk about mechanical modalities, it involves the use of our hands. The hand is the most precious tool that the physiotherapy has. When the patient, physiotherapy put the hand on the patient, we'll be able to know what is going on within the muscles. Is it tensed? Is there a spasm there? And give the physiotherapy a lot of information about the musculoskeletal system that they are touching. We manipulate joints to free up restrictions, and we also apply a lot of physical agents that ranges from ultrasound, not the diagnostic ultrasound that my friend will use, but this is called therapeutic ultrasound. It's one of the mechanical modalities that we use, to shortwave diathermy, electrical stimulation, biofeedback. I can name, go on and on and on. Those agents are very in the hands of physiotherapists.
It's good, I'm learning a lot, Prof. Let me confess my ignorance. Ordinarily, I'm sure many of us, we just look at the physiotherapist as someone who comes around when somebody is recuperating. You are trying to just help the person on how to walk again. Maybe somebody who has had fracture or something. My ignorance has always been limited, in that aspect, as if that is all the physiotherapist does. Now you have educated me better, and I thank you very much for that.
Okay.
Now, physiotherapy, reproductive health, what's the relationship?
Oh, very good. Well, physiotherapy, as I indicated, being a healthcare profession, has 7 specialties, of which obstetric and gynecology physiotherapy is one of them. Okay. There are a lot of conditions in obstetrics and gynecology that physiotherapy treats, and I'll just give a couple. One of which is chronic pelvic inflammatory disease, in which the patient has a lot of pain that may persist for a number of years under the watchful eye of the obstetrics and gynecologists. And in most cases, such pain are non-responsive to antibiotic therapy. And so, including, of course, pain modulation. So such patients can benefit from physiotherapy. As a matter of fact, my friend and I were the first to report in 1989 precisely, to report the efficacy of shortwave diathermy in the management of chronic pelvic inflammatory disease. And it was published in one of the most top journal in physical therapy called Physiotherapy Journal. And it's well-cited research work.
All right. Professor Konofo, as an obstetrician gynecologist, how often do you require the expertise of this physiotherapist in your practice?
Well, as an obstetrician gynecologist, I would say I personally and most gynecologists, we do multidisciplinary, multifunctional care. Because when a woman comes to a gynecologist, you look beyond the immediate problem that she comes with, and therefore look for auxiliary doctors or nurses or professionals who can help alleviate the problem of that woman. She's just give an example of chronic pelvic inflammatory disease, for which we try to treat with antibiotics, and yet the patient will come back and say she's not getting better, the pain continues. Then in that case, you have to bring in physiotherapy to do a lot of things. Things like renal and urinary incontinence, whereby the woman passes urine involuntarily, which is a very stressful condition. Again, can be handled in collaboration and in conjunction, in partnership with physiotherapists. Not to talk of birth itself, when a woman goes through normal delivery and he wants the muscles to come back to normal, become lax again, to become strong again after delivery. So that things like prolapse, when a woman delivers and has had a traumatic delivery, it's possible for the womb to start trying to come out, and the muscles there and fibers to be very weak. And apart from some surgical measures you can do to tighten the place, sometimes those surgical methods may not be appropriate. And even when you do that, you may still need to do physiotherapy to tighten the muscle so that the woman can function maximally, and so on and so forth. There are so many conditions. And more we encourage clinicians to work in partnership with other healthcare providers so that they can provide optimal care to their patients.
Okay, Professor Balogun, you have worked from the onset with Cerhi. Could you please give a candid assessment of Cerhi?
Cerhi, I would describe Cerhi as one of the flagship institutions in Africa that provides capacity building training for healthcare professionals in the area of reproductive health. And Cerhi, being probably one of the few internationally accredited centers, sets itself apart. And the rigor of the research that is ongoing at Cerhi speaks for itself. And during my association with them, I had the opportunity to participate in some of the research with my friend, both in the area of maternal mortality in Benin City, in which they designed an intervention experiment that shows that maternal mortality can be decreased with appropriate intervention. And also when I came in 2019, we carried out research in the area of COVID-19, a phenomenological research that documented the life experiences of individuals recovering from COVID-19. So Cerhi's research is very rigorous, and they are well respected all over the world for the quality of work that is being done. It's by no means an accident, since Konofo is the one leading the center.
And Prof, do you agree with his assessment?
Well, I'm a humble man, so I mean, these days it's very easy for people to confirm all you said. Just like Google Scholar, go there, PubMed, look at what Cerhi has done. We have a website. So that's why anybody coming to boast about what he has done can often be confirmed by just Googling Cerhi on internet, or Googling my name or his name on internet to find out the true position. So I haven't said that. I think that Balogun himself has brought a lot of energy and preeminence and strength in terms of research capacity building. And Cerhi exists, as you know. I think I want to take this opportunity to introduce Cerhi again.
Okay,
In the University of Benin, it provides trains masters and PhD students in the fields of reproductive health, which is one of the only, I think it's reproductive health, the MScs and PhD in University of Benin, Cerhi, is the only one of this kind in Nigeria, specifically for reproductive health. We also do masters and PhD in public health. I do masters and PhD in health economics. As you know, health economics is a very poorly established program. It's not very well established in the country. And then we also have masters and PhD in nursing. Those three difficult areas, which help to promote the concept of public and reproductive health. And we are doing very well, I can tell you that. And we have students from all over Africa. And the reason that we have partners across the world, including these from University of Chicago, we also have partners from Harvard, from University of Louisville, from University of Malawi, from Canada, Ottawa University, and so on and so forth, University of Leeds. And that is to ensure that we're not cocooned. Knowledge of reproductive health is not just local or national, yes. It's international. And so we learn from each other, we cross-learn. And our students, before they finish their PhD, they are sponsored by Siri through the World Bank project to travel to countries like US. They've been to Harvard, some of them have been to Louisville, some of them have been to Ottawa, some of them have been to Ghana, some of them Malawi, and so on and so forth. We sponsor them to go because just training students on textbook knowledge without physically seeing what other countries and learning from programs that have been established around the world can be very daunting, can be very difficult. So we've established a program that ensures that our students are ready, they are practically ready, hands-on ready when they graduate us. And if they do a PhD, for example, we often have collaborate partners. We have a primary supervisor, we have a secondary supervisor in a secondary area that the candidate is knowledgeable about. We also have international mentor in that same field. So every PhD candidate in Cerhi has a mentor either in US or UK and so on and so forth. So to make your learning much more broad-based and much more international. I'm very excited about Cerhi indeed. And I believe that in terms of reproductive health, we have come to break the grounds, new grounds in terms of
it's apparent. It's apparent, yes. Professor Balogun, now that we're talking international audience, how well have you been able to promote what Cerhi does, especially in relation to the training of postgraduate students?
Well, in conferences that I make presentation in Nigeria, in the United States, yes. I reflect Cerhi in my slides. And my goal is in the future to invite some of my friends to come to Nigeria to participate in workshops that I hope I'm going to be giving in the coming years, and also participate in some of the ongoing research at Cerhi.
Prof, I understand you are a prolific writer. I'm even looking at one of the books that you recently published, The Nigerian Healthcare System.
Talk about it.
Could you tell us, could you tell us a bit about the book?
Well, in the last 3 years, since 2019, I've published 4 books actually. These are just the 2 latest ones that I've published. But to speak more specifically on the healthcare system, Nigeria healthcare system is known all over the world to be one of the most inefficient healthcare system, one with the one of the most poor health outcomes. There was a study done by WHO in 2000 that rated Nigeria healthcare system 187 out of 191 countries. And a more recent study done in 2018 by a guy known as Foreman and published in Lancet rated Nigeria healthcare system as 140 over 195 countries. So the data is there. And in terms of healthcare outcomes, we have the second highest country with the high maternal mortality rate. Life expectancy in Nigeria is only 52, 53 years, while countries have life expectancy about 83, 85 years old. So I have always been very curious about our healthcare system in itself, because Nigeria have had the first national healthcare policy about healthcare in Nigeria dates back to 1954, that we had a healthcare policy But up to now, we don't have universal healthcare, which many countries, many African countries like Rwanda, Ghana, South Africa, have universal healthcare. So access to healthcare in Nigeria is very poor. So I've always been intrigued to find out what are responsible for why our healthcare system is so poor. And so this book provides a very nice read into the history of healthcare in Nigeria, the challenges that face our healthcare system. It's a well-documented book. It's a 14-chapter book. So I believe with a very good government, Nigeria healthcare system could be resuscitated from its present comatose state, as I describe it in my book.
So until a very good government, the system remains. Are there no specific interventionist measures that you have outlined in the book?
Absolutely. Actually, one of the chapters talked a great deal about political as well as system improvements that can be made to resuscitate our healthcare system. One of the primary reasons why our healthcare system is what it is because successive governments in Nigeria do not build upon the achievement of one government to the other. The only government in Nigeria since 1947 that have made a proactive improvement in Nigerian health system by way of policy is Olusegun Obasanjo's regime, which not only improved the percentage contribution to sustaining the health care in terms of budgeting, but is the first government that at least made an attempt to deal with the issue of health insurance, because health insurance is what guarantees access to health care. They were the first government that has an health insurance program, although not much progress was made after they left office. And unfortunately, as we are talking now, Nigeria healthcare system, health insurance level of coverage is only 5% of our population. And this has been what it was during Obasanjo's regime. So not much progress has been made. And until we can improve our healthcare insurance, then our access to healthcare will continue to be poor. But the major reason why our healthcare system is bad is the level of funding by government. Nigeria is one of the only countries in Africa whereby the budget allocated to healthcare is less than 5%. Even in the middle of COVID, you will think the government should increase funding to healthcare. There was a conference in 2004, the so-called Abuja Declaration, in which African head of state met in Abuja and signed a treaty that they will allocate 15% of their annual budget to healthcare. Many African countries have been able to meet that benchmark. Nigeria is the only country that have not come close to even 10% of our annual budget on healthcare. Last budget, as I indicated, is 4.7%, I believe, of the budget. So until we can allocate more funding to our healthcare, we built all the edifices, but it's an empty shell because there are no equipment in the hospitals, and the morale of the staff working there, obviously, they are not well paid, and the condition of service, you are well trained, but you don't have equipment to treat your patient.
Professor Okonofo, all attention appears to be focused at the top, the federal government. Is there any way the governments at all the levels can be prevailed on to take health care more seriously in Nigeria?
Yes, actually, it's not only federal government. Actually, health is on the concurrent list. So that there are certain things the federal government does and is doing, and also there are certain things that the state governments are supposed to be in charge of, general hospitals, and then local government. I can actually tell you about the 3 tiers of government because I've worked I know what he's talking about. And all the three tiers of government, the federal government is doing the best among the three tiers of government. Only a few state governments give priority to health, even do health at all. Whereas local governments, in fact, as far as I'm concerned, have completely disappeared from the health administrative structure of this country. So the federal government develops policies, runs the teaching hospitals. I think the federal government is doing more than any other state government. Most of government, because health is not a visible, to them, health is not a visible form of development. Indeed, health is the most visible form of development. It is the center of gravity of development. Because whatever we do today, whether we are building airplanes or driving cars, the objective of that is for us to have good health. But our people don't know that. So they would like to build skyscrapers that mean nothing. They would like to do other fanciful things. But they don't know that a single life that is saved is a very important contribution to development. So, and I think that our state governments particularly should be asked to do more. Federal government is doing it, they should do more. But the state government should do more, and local government, to me, should be woken up from their slumber currently, because they are the owners of, they are the ones to manage primary health care, which you refer to. And today, we have almost 42,000 primary health centers. I can tell you that only about 3 or 4% of them, mainly located in states like Lagos State, maybe Rivers, Abia, Ogun State, perhaps Udo State, my other state. Those are the only places where you can say primary care seem to be working. In other ones, they've disappeared completely. So state governments must do more for health. And coming in 2023 and beyond, that is one of the things we should put in the campaign agenda of political parties. Any political party does not give me a good agenda for health, I will not waste my vote on that party.
Absolutely.
I believe the people are listening. Lastly, Professor Balogun, what advice would you give to Cerhi and operators of similar programs in Nigeria?
Well, I think Cerhi is well situated. Cerhi needs very little advice. As I said, it's a flagship. But other centers of excellence in Nigeria, my advice is for them to pursue international accreditation. There's a big difference between the type of accreditation we do in Nigeria and international accreditation, which is more rigorous. International accreditation would require you to do what we call self-study, meaning you will study yourself, you will identify your areas of strengths and weaknesses, and come up with plans to address those weaknesses. And if you lie, when they come on site, they will find out, so you better not.
Exactly.
And so, I mean, no program is perfect. So when they come on site, if you just stay what your weaknesses are and how you're going to address them, you'll be fine. And so accreditation, as is done in developed countries, bring a lot of rigor to programs, and in that sense, you will aspire to do better in your services.
Thank you very much, Prof. The program has been Cerhi Hafa. In the last 25 or so minutes, you have been listening to two experts, Professor Emeritus of Physiotherapy at the Chicago State University, USA, and Associate as well as partner of Cerhi, who is currently in Nigeria as a Carnegie Fellow, Professor Joseph Balogun. Once again, Prof, you're welcome.
Thank you very much. Thanks
and
for
I
having me.
hope you have a very nice time while in Nigeria.
Absolutely. My friends made me.
Yes, that's fine.
Very
and you have also
comfortable.
listened to Professor of Obstetrics and Gynecology, Director of Grants and Research Development Administration, as well as Center Leader of Cerhi, University of Benin, Professor Friday Okonofwa. We thank you for watching. Join us again.